So let's just take a few moments here. I want to analyze a few different exercises and give some feedback on how we can change things. So first exercise is the squats. And we do a squat in order to strengthen our quadriceps through knee extension and our gluteus maximus and our hamstrings through hip extension. So when you're doing a squat, some things that could go wrong, you could increase your lumbar lordosis by doing it incorrectly. And what we mean by this is that is overextending the low back, okay? So where people seem to arch their back in a squat, that will increase your lumbar lordosis. Or perhaps you do the opposite, that you round the low back. Okay, so you decrease the lumbar lordosis and you round forward. That movement will increase your risk of a disc herniation. So increased lumbar flexion will increase the risk of disc herniation. Other issues can be patellar tendonitis. So if you're not tracking properly, so if your knees are not tracking properly over your ankle and feet, it can irritate the patellar tendon. So the quadriceps tendon going into the patella, into the patellar ligament. That area becomes irritated and inflamed. And then also, if you are doing a heavy barbell, sometimes people find discomfort in their neck. So things that you can do, you can make sure you can sort in the depth of the squat, so only going half depth, so maybe not even doing to the 90 degrees, and make sure you work in a pain-free range of motion. You want to make sure that their tracking is proper with their knees. So their knees are staying hovered over top of their ankles and the back part of their foot, that the knees are not moving inwards or not shooting far ahead, that they keep the weight in their heels. That will help them maintain positioning of the knee. That if you're having a hard time with the barbell, that you maybe just are doing body weight squats. And then I'm not totally sure how they mean holding a barbell behind the head while squatting. If you're having neck discomfort from holding a heavy barbell, you might be better off using dumbbells instead, or a trap bar, which is a bar that you'd have your arms straight down. You would never hold a barbell behind the head, so that makes it, to me, sounds like you're holding it balanced. If you're using a barbell, it's not actually positioned on the neck. It should be positioned on the shoulders. So it's a certain positioning there. Other things you can do instead of just a classic squat, you can do a ball squat where you have a ball behind you, in between you and the wall, so that you go down till your hips and your knees and ankles are all bent at a perfect 90-degree angle. Or perhaps they're doing a smaller isometric squat and just holding it until they get the strength up. Perhaps you're doing a leg press machine, because with a leg press machine you could do a lot less resistance. The other thing with a leg press machine is if you're having any spinal issues, the leg press machine takes that out of the equation. The lunge. So the lunge, remember, a lunge is just a one-legged squat. So it's going to strengthen your quadriceps, your gluteus maximus, as well as your minimus and medius, as well as your hamstrings. And then they group together the hip abductors I've already mentioned, as well as hip adductors. Same kind of issues will occur. Increased lumbar lordosis, so they'll arch through their low back. That's hard on the posterior elements of the spine, so they want to maintain neutral spine by bracing. Disc herniation if they are flexing forward too far, so they round their low back. Patellar tendonitis, so same rules of tracking apply for the lunge as applied to the squat, so that knee needs to stay above the ankle. And then increased kyphosis. I find there is a tendency when people lunge, when you do a lunge, your upper body should stay upright. You should stay up. You don't bend forward at all. And for some reason, when people lunge, they feel like they need to bend their upper body down to bend forward, and they don't. They should stay upright. So simply cueing these things. So be aware of these issues. So if someone is rounding their back forward, you cue them to stay upright. If their knee is moving in the wrong direction, instead of moving forward or moving inside, I correct that. Other things I look for is to make sure the weight is being driven through the front heel, not the toe. I make sure that the feet are hip-width apart, not like they're on a tightrope, but a little bit of space between the legs before they do the stride. Um, how can I modify things? I might choose to do a stationary lunge. And in fact, if I'm working with more of a beginner, I'll definitely start them on a stationary lunge where they would hold the lunge position and just go straight down, straight up, and they could even hold on to something. From there, I would have them lunge backwards. I find it easier to lunge backwards and forwards. So they'd stand up, they'd step one leg back, and go straight down. Then I could have them stepping forward with the lunges, and I could progress them to walking lunges. Once they know what they're doing, they have the stability. Alternative things I could do, I could have them do an isometric lunge. So maybe I have them just hold the lunge position and go part way down and maintain that. If I want to make it more difficult, and these ones will make it more difficult, I could elevate that front leg or elevate the back leg. That will definitely challenge the balance more. Or else if I want to make it quite complicated, I could use a Bosu. Okay, that's the half ball. It stands for both sides up, Bosu. And so if I put my front or back foot on there, it's going to dramatically challenge my balance, making the lunge harder. So push-ups. So the big muscle groups that it's going to strengthen, and it won't strengthen the rhomboid so much. It'll be more the pec major and the triceps and the anterior deltoid. That is what's going to be strengthened by the push-up. As well, it's wonderful because it trains you more so than a chest press. It trains you to keep the entire body and the core body nice and rigid as you move your body through a plank position. So some mistakes that are made is people fail to keep their neck and their spine neutral. So they sag through the low back and they drop their head forward. I find that they hang into it. The biggest mistake I see is people drag their hips behind. So they arch through their low back. You also want to watch, I tend not to see this one as much, but technically overextending the elbows. You want to make sure they're not locking out at the elbows. So things that we can do to make things different for the push-up, we could reduce our lever length. Okay, we could do that and make it easier by placing our knees on the floor. That shortens the lever. When the lever is shorter, it's not as hard of a job. We could also sort of change things where we put our hands up higher. It's going to change the angle at which gravity pulls on us, which will also make it easier. So this will be reducing the effect of gravity, and we could keep elevating the hands higher and higher until potentially we're doing it against a wall. If we want to make things harder, we can actually increase instability with our hands on a Bosu or stability ball. Our hands, or we can put our feet up on the Bosu or stability ball. Makes us less balanced. Alternative things, so a kneeling push-up, that's reducing the lever. We could play around with our hand width. So if our hands are more narrow, it's going to require more triceps because it puts the chest, the pecs, at a disadvantage. A little bit wider is going to be more chest. Don't let the arms go too hard. It'll get hard on the shoulder joint. A full push-up would be from the toes. That would be more challenging. Or else if I want to make it even more challenging, I could do a decline push-up. So I would elevate my feet onto a bench. And then it takes me, it's going to make it more challenging from the angle which I'm working. Abdominal curls. So really why we do an abdominal curl is to strengthen our rectus abdominis. And so where people go wrong with this, so people will do excessive neck movements, so they'll pull with their neck. Technically, you have to watch for lumbar hyperextension if you're using a stability ball. For the most part, I actually find it's the opposite. It's hyperflexion. So the person's trying to lift themselves way up when really all they need to do is move the rib cage towards the hip bone. So instead they're trying to crunch to get themselves high off the ground. That would be excessive lumbar flexion, and that would be hard on the discs in the lumbar spine. So avoiding excessive neck movement, I could change around my arm position. So I could have my arms resting on my legs or across my chest or overhead. I could also have my feet supported on the bench or wall. I could have my body positioned differently. So maybe I'm working on a football or a Bosu. If I'm having excessive neck movement, I could train the individuals to lift with their rib cage and not with their chin. And I could simply cue them not to go too high. So I always use a cue, rib cage to hip bone, rib cage to hip bone. Other things that they can do instead of an ab curl, they could do a pelvic tilt, Or else if they really are lacking the strength, maybe they're doing Kegels or ab bracing before they even worry about trying to lift part of the body. So some safety considerations. When exercising, and this especially, this can happen anytime, but um, tends to be more frequent with cardiovascular training, is when should a participant slow down or stop? So these are going to be signs of over-exercising, where usually their heart rate's starting to get too high. So absolutely, if the client requests to stop, let them stop. Okay. So if they perceive that they're in too much discomfort, allow them to stop. If they're all of a sudden experiencing undue fatigue, so they're doing a class and they are suddenly absolutely exhausted. This one I always will slow down or stop, and this is also with resistance training, if they no longer doing proper form or technique. If you're no longer doing a proper push-up, I have you stop the push-up. There's no point training bad technique. If this is a fitness class or like a cardio class, if all of a sudden if their movements become abnormally sloppy or uncontrolled, that would tell me something was going on. If they have a breathing issue, so all of a sudden they start to wheeze, or they have severe onset of shortness of breath, so all of a sudden they're gasping and they're having a hard time breathing, I'd have them slow down or stop. If they're dizzy, they have any kind of confusion, if they change color, if they go pale, or especially if they go blue. Dyspnea means a hard time breathing, or nausea. If they're experiencing those, I have them slow down and stop. Cramps in their lower upper body, I have them slow down or stop. Ataxia is a loss of muscle coordination, so if their movements are just going weird and not working properly, slow down or stop. If they have vertigo, which is dizziness, visual or gait problems, slow down or stop. Suspicion of heart attack or angina, that's chest pain, slow down and stop. Or any other sudden changes. So now, these ones we all kind of watch. And when we say slow down or stop, we don't mean like, okay, stop, stand still. Remember, we would put them through a cool down. But if all of a sudden the individual just feeling a little bit off, I would have them slow down what they were doing. So if we were doing, say, we're doing jumping jacks, I would have them do a lower intensity jumping jacks. So maybe they're doing heel digs instead. Or if we were sprinting, I would have them slow down to a jog instead. Okay? And if they seem to recover from that, they can try to increase back to their intensity. But if that slowing down is not sufficient, I have them stop. So they would go into a cool down and like continue to decrease intensity until they've come to a stop. Okay? Ones that we're really, really watching, that any kind of heart pain, that angina, that would be immediately going to a cool down. Ataxia, immediately going to a cool down. Anything that seems very out of sorts. I always say that when people, you'll see their pallor will go, especially high intensity stuff, that all of a sudden they look confused to a degree. And I'm not talking they're completely disoriented, but they just seem off all of a sudden. I'll have them cool down. So I'll do a lot of burpees in my class. So they'll be doing burpees, and all of a sudden I'll look and someone just looks off. Their movements aren't as coordinated. Their color's a little off. Usually I'll walk over and go, just do some squats instead. Stand up, do some squats, catch your breath. I would say 99.9% of the time they do that for a minute or two, they're able to rejoin in. Okay, but anything more, always get help. Don't ever just push through something because yes, like something bad can happen. You need to respect their limits. So there can be issues. People talk about a stitch or a cramp, right? Stitches are more in the diaphragm, so all of a sudden that cramping sensation in the diaphragm or a muscle cramp. If they are getting mild stitches or cramps, have them just calm down their intensity a little bit and see if it goes away. And so usually if it's a side stitch, I'll have them do some forceful exhales as they slow down the intensity. That usually clear up. If they're cramp, I have them do smaller movements. Usually they're calf cramps. That's usually what I find. A smaller kind of movement, see if it eases up, and then I'll have them gradually return to their intensity. assuming it stays away. If for any reason it doesn't go away, you take them into a cool down and reevaluate at that point in time. Perhaps they're dehydrated. Perhaps they maybe hadn't been eating enough. You could always come back to exercise another day, so be safe. And also, um, there are issues too where participants will have prolonged fatigue. So this is getting into the overtraining, that they're coming back class after class and they're exhausted all the time. We got into this love of high intensity stuff, and sometimes we forget that exercise is supposed to benefit the rest of our lives, not take away from it. So if you go to a class and you're giving 110% every single class, and you're leaving class and you are exhausted and tired and can't move and you hurt, then that class is not benefiting you anymore. It should strengthen the rest of the day. You should, yes, you will be tired at the end of the class, but you should be stronger for a class, not weaker. And it's also worth noting that dizziness is not okay. So if somebody is experiencing dizziness, we need to change things up. If they're dizzy, they are at a higher risk of falling or injuring themselves. So sometimes they're dizzy just because they're working at a little too high of an intensity. It might be an issue with their blood pressure. Their body might not be adapting. Bring back the intensity. Dizziness can also potentially be an issue with blood sugar levels. You want to return, okay? So what we would do, and it does say here the activity should be stopped immediately. Like yes, no. What they mean by stop immediately is, let's say you're jogging and you're getting dizzy, then we're slowing you immediately down to a walk for a minute or two, and then we'll sit you down. Okay? If it's extreme dizziness, you would actually have the individual stop and lie down with their legs in the air for like with their legs elevated. That would be an emergency stop. But for the most part, you'll find most participants can go immediately into a cool down and then stop from there. Okay? So once again, if it's extreme dizziness or something's extremely going wrong, you would lie them down, lift their legs up. So the RICE principle, we are not certified to treat injuries. You will have your first aid. So first aid allows you to deal with acute meaning immediate injuries. So we're not talking about rehabilitating, but rather something happens immediately. You are going to follow the RICE principle. You should rest, immobilize, put cold on it, and elevate it. At that point in time, so any musculoskeletal, they sprain, they do any kind of injury, rest, immobilize, put ice on it, so cold, and elevate, and you send them to a healthcare professional to be further evaluated. Okay, so you just deal with that acute. Essentially, all you're going to do is keep care of them until somebody more qualified takes care of them. So emergency procedures, make sure you're aware of the procedure for your facility, know where there's a phone that you could use, know where to find a first aid kit, know where the emergency exits are, be familiar with the protocol, and know where you are. If you have to call 911 and you don't know what street you're on, the street address, you need to know that information to get emergency personnel to you. There are different emergency procedures for different places, and it's really important that you are aware of emergency plans at different facilities. What do you do? Are the front desk staff trained that they could take over from you immediately? Where is the first aid kit? What paperwork do you need to fill out? There's usually incident reports. Find out that information. When in doubt about anything, dizziness, chest pain, anything, if something doesn't seem right, call 911. You'll know, and as a leader, you will know what normal fatigue, that when people are breathing just a little too heavy, what it feels like, what it looks like when they need just to calm down just a little bit and decrease intensity for a few minutes. You'll start to see that difference between them and someone that's experiencing an asthma attack. There's a very, very big difference. And until you can easily see those signs, talk, communicate with your participants, and call for extra help when you need it.